Governor Schwarzenegger's vetoes of the bill, and mind you, this was at the moment when he could have either signed it into law or vetoed it, and the choice was entirely his. One of his reasons for vetoing it was that it was not politically feasible. I guess he couldn't make himself do it.
Dick, what would this do to the income of the healthcare workers, physicians, and so forth? What was the impact?
Certainly for healthcare workers, other than physicians, I think it would enable a dramatic increase in compensation because everybody walking into the hospital would be carrying the same piece of plastic that the wealthiest people in town carry. And you know, today, when a person on Medicaid walks into the hospital, that brings the hospital a lot less money than if the wealthiest person in town walks into the hospital. Under New York Health, all health plans would be leveled up because, believe me, the people with wealth and influence in New York State are going to make sure that the health plan that they are part of pays their doctors and hospitals very well. And as a result, my doctor and your doctor and the hospital that all of us would go to will be better paid as well. You know, a few weeks ago I was speaking to the Westchester County Ophthalmological Society. If you know anything about Westchester County, their eye doctors treat, you know, a pretty classy group of patients. And at one point, one of them said, you know, Mr. Gottfried, you said that, you know, 98% of households would be spending less than they do now, only 2% would be paying more, and frankly, we're in that 2%, most of us. So why would we want to support your bill? I restrained myself from saying, didn't they teach you something about that when you went to medical school? But I did not say that. What I did say, though, was, you know, with our current system with deductibles and out-of-network and all that, you've got to have some people who come to you for treatment who can't pay their bill. And they all kind of nodded. And I said, if you've even got a couple of unpaid bills that are now going to get paid, that's going to undoubtedly get you a lot more income than the increase in the premium versus what you're now spending on healthcare might be. Well, I think it's going to take a while for it to sink in because, you know, I think they all still went home saying, I'm going to have to pay more and it's a government plan. I'm sure they're going to pay me less, so why should I support it? You know, the reality is they'd be getting paid more, they wouldn't have any unpaid bills, and the amount of increase in their premium, unless they're a really successful ophthalmologist, is really going to be very little. But, you know, the suburban ophthalmologists are probably one of the later constituencies that will join the movement. Although the state chapters of the family physicians and the pediatricians have endorsed the bill. The Doctors' Council in New York City, which is the union representing the physicians in our Health and Hospitals Corporation, has endorsed the bill. And they, in particular, understand that the place where they work, the New York City's public hospitals, those hospitals' economics will radically improve